going to talk to you about the difference between harmful versus safer disinfectants in health. So I wanted to start by reminding everybody that respiratory viruses are transmitted primarily person to person. So the person is the source of the infection. And this is by respiratory droplets of many sizes that are emitted when a person talks, coughs, sneezes, sings, etc. There are three main routes of exposure: droplet transmission, fomite transmission, and aerosol transmission, which I'm sure you've heard about. And we don't really know with certainty the relative importance of each of these three mechanisms, but we know that aerosol transmission is the most likely source, the most likely route of exposure. Next. So the risk of infection by touching surfaces, it took the CDC and the WHO almost 1 year to recognize or publish that the risk by touching surfaces is generally considered to be low. And that's because there's a long chain of events that need to happen for someone to become infected through contact with surfaces. I might say, except for children. The last step in this chain of events is touching your eyes, your nose or mouth with a contaminated surface, with a contaminated hand. So the best way to make sure that the chain is broken is by not necessarily by cleaning the surfaces periodically. Next. So therefore, I believe we are abusing disinfectant use to this initial emphasis by the CDC and WHO on surface cleaning, which led to overuse of chemicals that were meant to be for periodic use, especially in hospitals. And just a reminder that most hospital-grade surface cleaners are classified as pesticides. Another important point that sometimes is missed is that soap and water are effective at denaturing the SARS-CoV-2 virus and therefore are very effective at inactivating the virus. And so are hydrogen peroxide and alcohol. Where people went to look for disinfectants is this list N approved by EPA, which until very recently was the only guide available. And I'll talk a little bit about the new source. Next, this EPA list N of disinfectants, this is a photo of the website. Up until last week, there were 636 approved products on this list. Importantly, soap and water are not on that list for whatever reason. And 299 of these products are based on quaternary ammonium compounds, which have known health effects. And that's because safety testing is not required for chemicals that are included on this list N. And that's something that most people don't know. Next. So this has two main arguments in favor of using the quaternary ammonium compound-based products are that they are readily available, they're commonly used, and that they are EPA approved. So despite these two arguments, very little is known about the long-term health effects associated with chronic low exposure. And studies have found reproductive effects, asthma exacerbation, and skin irritation. So remember, there are many products that have been tested for safety and be used for safe replacements. And we can find those products next in this wonderful resource, this new website that has also been mentioned already, saferdisinfectants.org. It's a unique tool that pulls information from the EPA's list N, is very user-friendly. It designates products by active ingredient, and it gives you a snapshot of which chemicals are actually safer to use. I urge you to check it out and pass the information. Next. People are most exposed to chemicals in healthcare facilities, cleaning staff, and people that clean their personal protective equipment, and other cleaning personnel in schools, public transit, food workers, and at workplaces and homes. Next. So we can reduce overuse and exposure by asking, is cleaning this surface really necessary? Is cleaning this frequently necessary? That's especially true for healthcare facilities, for food processing places. And if it is really necessary, we need to start using less toxic products and methods for cleaning and disinfecting. So consider changing the process. Consider if soap and water are an option, and increase ventilation, which is the main way that we can reduce exposure. Next, thank you very much.
Thanks so much for watching our expert on IPM. I'm Sean Lynch, the director of the IPM and Healthcare Facilities Project at the Maryland Pesticide Education Network. We hope this has inspired you to consider new steps you can take to make your facility safer for your patients and staff. Please reach out to me at email at sean@mdpestnet.org if you have any questions regarding implementing IPM at your facility. To learn more, please visit the project at mdpestnet.org, choose projects, and then the IPM and Healthcare Facilities Project.